Ever trial to see whether screening for a heart condition could prevent strokes. Hello, first tonight, researchers in Cambridge are starting the largest ever trial to see whether screening for a heart condition could prevent strokes. Atrial fibrillation causes an irregular heartbeat and affects up to 1 in 10 people over the age of 65. It makes sufferers 5 times more likely to have a stroke, but many are unaware they have it. 120,000 patients over 65 in 300 GP surgeries will take part, and it could mean screening becomes available on the NHS. Louise Hubble reports.
So, Janet, this is the machine which we use to record your ECG multiple times per day.
At 71, Janet is at risk of the underdiagnosed heart condition, atrial fibrillation.
So here is the machine. We'll just turn that on there.
Now, a new trial has begun to screen people over 65. This small device is used at home 4 times a day to monitor if a patient's heartbeat is irregular, a symptom of the condition.
Well, I think it's absolutely amazing. It's so easy to use, and to be able to do it in your own home as well and trial from there, I think is really good.
It's so important because if patients are diagnosed with the condition, it could reduce the risk of them having a stroke.
People who have that, they're at more risk of building up blood clots inside their heart, which can break off and cause strokes. And if we can find out who is either in atrial fibrillation all the time or intermittently in atrial fibrillation, we can thin their blood and significantly reduce their risk of strokes. Most of the time, people don't notice that they have it. Some people, sometimes if you go into this funny rhythm, your heart can go very quickly and that can give you symptoms. And so people come along to the doctor occasionally with symptoms, but the majority would not notice that they have it.
Now the largest screening of atrial fibrillation has started and is being coordinated by Cambridge University. 120,000 patients aged 65 and over from 300 GP surgeries will take part. Some will be screened and some won't, and then the 2 groups will be compared. The numbers need to be so big because only 3 to 4% of those taking part will have the condition.
So this is a normal heartbeat with the beats regular. This is atrial fibrillation with the beats irregular.
If the trial proves successful, the implications are huge.
Hopefully the National Screening Committee, the NHS, would take up a national screening programme for atrial fibrillation, and that would hopefully lead to optimally about a 10% reduction in the number of strokes that occur in this country, so very important.
That can only happen if the programme shows screening would be good value for the NHS and not cause patients unnecessary stress. But these trials are, of course, the only way science can advance. Louise Hubble, BBC Look East, Cambridge.